Hello, welcome to Mobility Wallets 101. This is a webinar co-sponsored by National RTAP and N-CATT, and we're so glad you're here today to learn all about mobility wallets. Little housekeeping, the recording and slides will be posted on the National RTAP website within a week. While the panelists are speaking, you can enter questions through the Q&A box, and they'll be addressed at the end of the panelist presentations. If you're having difficulty with Zoom, please chat with us and we'll be happy to try to help you. At the end of the webinar, you'll get a QR code for a post-webinar survey. You'll also get this tomorrow. Please stay tuned for additional webinars or workshops on this topic and other topics. So I'm Kara Marcus. I'm the Knowledge and Resource Manager for National RTAP. And if you're unfamiliar with us, we're a technical assistance center funded by FTA through the Section 5311 Rural Program. We provide free training materials and technical assistance to rural and tribal transit providers and to state RTAPs. We're governed by a review board, 14 state DOT and rural and tribal transit agency managers from across the country. You can learn more at our website, nationalrtap.org. We are here for you in every way. We provide training, information, technology tools, peer networking, and assistance. Please bring us your questions. We really want to help you find answers. National RTAP also manages a library that's a project of FTA and all of its technical assistance centers, including N-CATT, and it's called TACKLE. It's a library all about transportation coordination. And it has another easy to remember URL, transportation-tackle.org. Now I'm going to just very briefly introduce the titles of our esteemed panelists. I see Stephanie, you raised your hand. Are we having any technical difficulties with Zoom or? No? Okay. Great. Okay, so we have with us today Andrew Carpenter, who's the director of N-CATT, the National Center for Applied Transit Technology, Ty Piontek, the director of operations for Clinton Area Transit, Valerie Leffler, the executive director of Phoenix Mobility Rising, and Kevin Wassam, the compliance specialist for Michigan DOT. So you'll hear all about them, their projects, and how they can help you with mobility wallets. So now I'm going to turn it over to Andrew, who will talk to you a little bit about N-CATT and mobility wallets in general.
All right, thank you, Kara, and hello, everyone. Thanks for joining. So N-CATT, as Kara mentioned, is another technical assistance center funded by the FTA. We focus, as you might guess from our name, on technology. And so we work with small urban, rural, and tribal transit agencies to understand the technology that's out there and what tools can help you as an agency achieve goals that you have. So we don't push technology just for the fact that it's out there, but we really help people understand what they want to accomplish and then how to go about doing that. So the QR code in the top right of the slide can get you to our website to show all of the resources that we have, as well as different ways of contacting us for either basic information or for more in-depth technical assistance. So we do work with states and also with individual transit agencies. So to talk at a high level about what we're going to talk about basically is what is a mobility wallet? This can pretty quickly fall into kind of a jargony world, but the basics of it are that if there's a mobility wallet, there's a central place for someone to have an account to pay their transit fares or their mobility fares if the mobility wallet includes items other than a transit system or multiple transit systems. The idea behind it is that this allows someone to use multiple modes or multiple agencies without having to switch between a whole bunch of different apps to be able to do so. From the passenger perspective, it does not make sense to them to have to go from one app to another, or one fare card to another, or have to go from one fare card to an app to another if they are crossing over different transit agencies, especially if they connect very easily. From that perspective, why shouldn't they be able to just keep on continuing their journey using one fare medium? And so this can help people to really chain their trips across different regions, or across different options that they have. And so that makes life a whole lot easier for people. And then also, mobility wallets can centralize a lot of information about mobility options as well. And so this would allow people to not only pay for their trips across a wide area, but also to know how to do so. And so similar to the payment friction that people face when you have to hop apps, it would be ideal for everyone, and make mobility much more accessible for people if they could see all the options they have to get from point A to point B that aren't necessarily within one agency or within one mode. So in the DC area, there is WMATA as one large regional transit system, but then also the surrounding counties and cities have their own transit systems. And so I'm able to trip chain across Metro Rail, take a Metro bus, and then also a Dash bus, and then Capital Bike Share to get home from work in downtown. I'm able to find all of that information in one app, though I can't pay for all of it in one. It takes two, one for the Capital Bike Share app and one for the Smart Trip. So this helps to simplify how people get around. Also, this gives people a lot more access to equity based programs, and it helps transit agencies push forward equity based goals. And so this helps to give people access to fare discounts or discount programs across multiple agencies again. So on the next slide, just to dive a little bit more into what these mobility wallets can accomplish, is, as I talked about, it makes movement a lot easier for people, and that alone is a big equity issue. But this also can promote higher ridership. A big barrier to people using transit systems is not even knowing how to even get started using it. So if you are able to show someone that with relative ease of information how to get around and how to use a system, they're more likely to use it. And so um, putting these accounts together across different transit systems can help out. And especially if someone goes to a new city within a region that a mobility wallet covers. So especially if you think of the state of California, really big state, if there were a statewide mobility wallet, you people traveling from Sacramento to Bakersfield could still use the same app, the same fare medium, and the same planning information that they would in either of those cities. And so then that way it reduces the need for them to download yet another app and create another account in a lot of cases. And then so then that helps with improving passengers' kind of perceptions of transit and understanding what's available to them, and therefore makes them more likely to use it, and it makes it easier for people who are regular users to maximize their use of the transit service. Also, as I mentioned, there's an equity concern here. If you have a mobility wallet, then the digital infrastructure involved in that allows for fare capping across, not only within one agency, but even across agencies. So if there is a daily or a weekly or a monthly pass that a transit agency has available, then a person can keep paying for fares as they go through this wallet, but then still reach a fare cap at the same value of one of those passes. And so this is especially important because the people who benefit the most from the discounts provided by fare capping are the ones who can least afford that upfront money. So this helps people access those benefits who most need them, but can't necessarily put forth the cost of a pass to do so. And so it also can give people access to more discounted fare programs and also can make it easier for them to apply for them. The theory behind this is that folks should only have to apply once for, let's say, ADA complimentary paratransit, and then every agency within this wallet should be able to apply that same eligibility across all of their systems. And so also early experiences have shown that this is also much easier for administration of fares. So the centralizing a system can reduce fares across fare costs and collection costs across agencies. And then also the universal eligibility across agencies, that reduces time spent evaluating applications um, and therefore frees up staff time to perform other activities to maximize transit services. So there are a couple examples out there. I mentioned California. There's a project called Cal ITP. And so that is coordinating fare collection across the state, as well as improving, it's focused on improving customer experience. And so this is where early results have shown that implementing a mobility wallet type of approach can increase ridership and also lowers fare collection costs. So still early days, but it's showing positive returns, you could say, on implementing and experimenting with mobility wallet. There's also kind of a parallel concept called universal basic mobility. And so instead of universal basic income, this is more targeted. And so Los Angeles Metro and Los Angeles Department of Transportation are piloting $1,800 annual subsidies to low-income individuals around the LA area. And this removes transportation as a barrier to getting to other social determinants of health or other opportunities that help people thrive. And so the experiment here is to see if you remove the cost of transportation as a barrier, does that help lift people up through the increasing their access to other resources. So that will also be great to see. Also, Michigan DOT is working on a mobility wallet project, which you will hear more about later. So before I hand it over to the more in-depth projects that are happening, we have some resources on fare payments. So we have a guidebook, fact sheet, and procurement case studies, but also most importantly, we provide direct technical assistance. So please don't hesitate to reach out, no matter how big or small your fare payment or other transit tech questions are, and we'll be happy to help. So thanks.
Okay,
Thank you so
everyone.
much, Andrew. Now we're up to Kevin, who will introduce the Michigan Mobility Wallet Challenge.
Okay, thanks, Kara. The Michigan Mobility Wallet Challenge is actually the third mobility challenge that the state of Michigan has put on and sponsored. The first two were just any kind of a mobility project. This one was specifically for the design of a mobility wallet. So we'll get into some of the details here. You go to the next slide. Thanks, Kara. MDOT, in conjunction with our Office of Future Mobility and Electrification, launched this project in 2022 to find a way to explore a pilot program for mobility wallets, which would aim to increase the interoperability of transit services and create greater access between modes of transportation. The goal, simplify the payment process, allowing riders or third-party stakeholders to load funds and or connect bank accounts to a single platform, and streamlining the mechanism for fare payment and collection. So what this does is it allows the passengers or the riders themselves or their advocates, if they have a family support system, a community action agency, if it's a benefit of their health insurance program, all of these people would be able to access and load funds for the passenger onto the payment service. So what this does is facilitates payment for transportation services, not just for bus systems, but a number of modes that we'll talk about here in a second. Like Andrew mentioned, it improves equity and accessibility. We all know how important equity is to the public transit industry. It allows riders to load funds and connect to bank accounts and credit or debit cards. And like I said before, it allows third parties to fund transportation for their clients, patients, or employees. So it's a good way for employers to be able to bring employees to the workspace in the event that they don't have their own transportation. Some of our additional partners include our Department of Labor and Economic Opportunity, as well as the Michigan Poverty Task Force. And the state of Michigan awarded $3.4 million. And those were all state funds. There's no federal funds involved with this project. And they were awarded to 3 pilot projects, 2 of them on the call with us, and they'll speak in detail about their projects. But grantees include an Echo-Lane project with Clinton County Transit and Phoenix Mobility Rising. And lastly, the Regional Transit Authority of Southeast Michigan. That's a kind of a coordinating council to streamline the activities of the carriers in the Southeast Michigan area. Detroit Department of Transportation, Suburban Mobility Authority for Regional Transportation, which encompasses the 5 counties of the Metro Southeast Michigan area. Okay. So the first one with Echo-Lane was a solution that enabled transportation providers to integrate all their modes, fixed route, complementary paratransit, microtransit, demand response, ride shares, and bike shares into a single mobile app. That project was almost $890,000, and our panelist Ty Piontek from Clinton County Transit will provide details here in a minute. The Phoenix Mobility Rising project was designed to meet the needs of veterans and to fill transportation gaps for families and individuals experiencing poverty. Funding level for that was $1.5 million, and Valerie Leffler's on our panel today, and she'll provide details on that project. And the final one was the Regional Transit Authority, or RTA. This is trying to enhance the capability to access multiple transportation services between multiple public transit agencies as well as other modes. Detroit Department of Transportation and SMART. The Q line, which is a street level light rail that brings folks into downtown Detroit from north of the city. The People Mover, which is an elevated rail service in the downtown Detroit area. Mogo, which is a bike sharing app. And at least one scooter company. I'm not sure if that has been determined. And they're going to test methods for deploying fare capping across multiple providers and subsidy programs. Funding for that project was $1 million. And it's currently wrapping up the end of the procurement phase. So this particular project has not begun as of yet, but we're very excited to see what it can do in the Southeast Michigan area. And then links here for additional information about the projects. A lot of information here, press releases, and things like that. Would invite you to check these resources and read about what we're doing here in Michigan.
Thank you so much, Kevin. And all of those links will be part of our PowerPoint that will be posted, so you'll be able to get to them. Now turning it over to Valerie Leffler, who will turn about Phoenix's project.
All right. Thank you. Good afternoon. Appreciate the opportunity to be here today and share about the work that we've been leading with the Michigan Mobility Wallet Challenge. Thank you, Kevin, for that fantastic overview. So Phoenix Mobility Rising's mission, we're a 501c3 organization for anybody who isn't familiar with us. And our mission is mobility solutions for the health and well-being of every person in every community. And the mobility wallet technology is essential to making that happen. Because we know this problem is this fragmented labyrinth of resources, policies, and programs that really do not work by and large for those who rely on it the most in the communities that we serve. Next slide. And when Phoenix looks at transportation, we really are looking at solutions to support health equity. Not only how do we get folks to the doctor, but how do we get folks to work? How do we get folks to church? How do we get folks to healthy food? And are looking at that whole person picture and tying together how do we create a solution that serves everyone? And again, the mobility wallet, based upon what Andrew and Kevin were sharing, is really a big piece of success in that model in addressing health equity. Next slide. And as Phoenix is solving this solution, or Phoenix's solution in addressing this challenge, is called a transportation assistance hub, where we have people who are in every community working alongside transit agencies and small businesses, but also hospitals, shelters, domestic violence programs, major employers, you name it. And then we have technology, which the mobility wallet is a big part of, as well as mobility as a service and a call center. We have community support, so the community is in the driver's seat for determining goals, identifying challenges, celebrating successes, and really coming together around how do we make mobility equity happen. And then from a capacity perspective, we partner with every type of transportation partner that's available in the community, public, private, volunteer, you name it, multimodal. Next slide. So for the Michigan Mobility Wallet program, we deployed this across 3 areas, not only an urban area like Wayne County or the Detroit area, but also in Kent County, an area that's both very urban as well as rural. And then what we would say is the third tier is the Jackson, Hillsdale, and Lenawee counties that are very rural, that resemble kind of where I grew up in a small rural community. There were 96 folks in my hometown. So when we talk about rural, we're not talking about the suburbs of San Bernardino, or LA. We're talking about, there's, 3 miles between you and your closest neighbor. Next slide. And in doing this, we laid this out in 4 very deliberate phases. First was, of course, planning, then technology development and implementation. Then we began rides, starting with veterans, because veterans arguably have the hardest use case to solve for transportation because of the fragmentation of the resource network, as well as their healthcare ecosystem, and then expanded to support households where a task force decided kind of what the eligibility criteria would be. And that was individuals who live in households with the 200% of the federal poverty level. And we are just wrapping that phase up right now. Next slide. In deploying the technology, we partnered with firms like Skedgo, which is an international mobility as a service firm, fintech partners like Mocafy, universities like Michigan State, University of Michigan doing a gut check. Phoenix can say it's great, but what was the real impact in the community? And then we partnered with Menlo Innovations and Sunderberg Farrar. They really are experts in user experience and systems design, knowing that we needed that outside third party to look at this with a fresh set of eyes, to look at this with an accessibility focus. And then partners like Metro Strategies, which is a disabled veteran-owned business that focuses on community engagement to make sure our message is on point. Are we talking about our program in the right way? Are we connecting with the right partners? Next slide. And in our transportation ecosystem, we had public transit with the Rapid, and then token transits, the technology that's integrated for both Detroit DOT and SMART, data, Care on Wheels, Hope Network, Key Opportunities. Lenawee County Public Transit, Ride Your Way, MoGo, Boaz Bikes, and Super Pedestrian. We're kind of those original partners that we came to the table because Phoenix is mode agnostic, whether it's public transit, bike share, ride share, scooter share. If you need wheels to get you there, we want you on our platform. Next slide. And we deployed it in phases, not being novices to this mechanism of getting technology into the community and getting technology that works not only in an urban area, but a very rural area. We kind of deployed in tranches. And the last piece of the puzzle that we are getting ready to roll out is the debit card. We're actually going to partner with Wayne State's mobile health unit in deploying and providing the cards to individuals who struggle with homelessness. And so we're really excited about that partnership to test out and deploy the debit cards. And we have data analytics and mapping also as a part of our project because we know that the data is essential in talking about what impact are we having. Next slide. And so here we have a little video about how the Michigan Catch a Ride technology works. So similar to any wayfinding app, you put in your pickup and your drop-off address, and then based upon those coordinates, it will determine what transportation providers are available in the technology. Then once you determine your time of day and your day of week, you're looking for that trip, it will then also triangulate who has service available during that time. So those social workers, those case managers, those care coordinators aren't on the phone like, do you provide rides after 5? Do you provide rides in this region? And then they can see the options and select which option works best for them. They also can note what kind of mobility options are needed in case they need additional assistance or door-to-door support. And then we collect the trip purpose, and then they can also leave notes and book that round trip. And then once they continue to payment, from there, then it basically deducts from the mobility wallet or the mobility budget, and they're able to then schedule and book that ride. And what this does is it enables us to deploy one technology across all the transportation partners that are working with us throughout the state of Michigan. So that same app I download in Detroit to access public transit, as well as Uber and private transportation providers, name it transportation providers, accessible service is the same one I'm using in Jackson, is the same one I'm using in Grand Rapids. So I truly have that one-stop shop experience. And there's a version of this technology that is also available online that case managers, care coordinators, social workers are using, and a platform. So it enables the public transit to quickly and seamlessly provide rides for these other transportation needs without having to have those social workers and those case managers go and buy bus passes, without having to tie up resources within the transit agency, trying to figure out how do we get those bus passes to you. It just creates that seamless experience. And then for small transportation providers or small businesses who maybe aren't using sophisticated API-based interface, we have a platform that enables them to receive a request and then decide whether or not to take it within the technology. So it's not automatically guaranteeing just because you put that ride request in there, that transportation provider is going to accept it, or that transportation provider has to also be spending thousands of dollars on high-end sophisticated software. Many of our transportation partners that are in our ecosystem are still using Excel, Google Sheets, some even a Post-it note, but they're able to interact with the platform and accept or confirm a ride within this kind of sophisticated mobility ecosystem to simplify things for that rural hospital or to simplify things for that shelter. Go ahead and go to the next slide. There's also, as I said, in the mobility wallet, the ability to add images, and so to show and designate the type of service that's available. This is an example with United Way. We have a partnership, and we can provide mobility wallets to individuals who are going to employment. With a click of a button, we can literally load funding into a wallet and add riders to that pilot or to that wallet that they can then draw down accordingly in seconds. So it makes and saves time for the staff and the partners at the community organizations, as well as the transit agency. Next slide. So for example, here's Obi-Wan Kenobi in our platform on the back end where they're in the system. And in order to add a wallet to the program, you literally just click on the button, add a wallet, and go ahead and go to the next slide, Kara. And then it will say, okay, how much do you want to put on the wallet and how often is the duration? And it's literally 2 clicks and it is that easy. Next slide. And then Phoenix is able to then see the mobility wallet has been added to the partner. They're able to draw down $50 worth of token transit bus rides on Smart or DDOT. All done. Took a matter of seconds. And so this is a game changer in terms of how do we get more bus passes into the hands of our community partners and also save time and efficiency on the back end. Next slide. And here's an example of a partnership in a wallet that we have multiple transportation agencies across multiple counties. So we have individuals who are transit agencies in Washtenaw, Wayne, Jackson, Hillsdale, Lenawee. Next slide. And here's some community partners that we're working with the Mobility Wallet program to give you kind of a breadth of different organizations. We're working with everyone where A Girl Like Me, Face Addiction Now, Jumpstart, Starfish Family Services, Sarah Metro, Focus Hope. These are organizations that are well known, as well as younger, newer startups that are addressing challenges in the Wayne County area as it relates to health equity and economic equity. Next slide. Because we know in the ecosystem, right, folks who are on this line with this is no surprise, but every type of transportation in our communities and in our society is fragmented, whether it's public transit and there's a paratransit application, it's Medicaid, oh, you make too much money, you're not eligible for this, or you're not old enough for Medicare that has that transportation option, but you can't afford that. TANF and SNAP has funding, Older Americans Act, Center for Independent Living. There's 130 different federal programs that fund transportation, and Phoenix is going to get rid of the silos with the Mobility Wallet and the Transportation Assistance Hub and create a bridge. Next slide. Because we know that in order to address health equity and mobility equity, transportation must be seamless to access and simple to use, not only from the perspective of the user, but the transportation agencies and organizations themselves and the agencies that are supporting the passengers. And we know this is possible because in 1997, this is the way food stamps looked. Go ahead, next slide, Kara, sorry. This is literally how food stamps were distributed across the US in the 90s, where you got this little coupon and you could only use it for certain types of cheese and milk and bread. But now, fast forward to 2024 or 2023, every state in the union and territories use these EBT cards. And so we see the Mobility Wallet as creating the EBT of transportation. Next slide. And we have data to show how we're making this impact. So all that Mobility Wallet data feeds into a database where we can see what's our average trip cost, how long are our average trips. Next slide. Where are the trips happening? Where do we see the growth? So on and so forth. So all that data is going into where are we seeing impact. So when we go to talk to elected officials, when we go to talk to taxpayers and community members, we can see where are we having impact? Where are we coming? Where are we going? Next slide. And we work this with the transportation program as part of this. The magic really lies in the working group. So these nonprofit partners that are booking rides that advocated for the proposal provided guidance on how to distribute funds. They've been linchpins in providing letters of support for additional funding to continue and expand the program, and are really in the driver's seat in terms of how do we want to distribute the funding? What is the data? What are we learning, and have been invaluable partners? And so the community really has been in the driver's seat since day one. Next slide. And we're using also to determine how much to put on a wallet. We're using this. Again, I said the 200% of the federal poverty guideline. We asked our Mobility Wallet working group, what do you consider, what number? And they are the ones who recommended these guidelines, as well as if you're also participating in Medicaid, SNAP, SSI, so on and so forth. Next slide. And so in our workflow as part of a Mobility Wallet during this data phase, there's definitely a full on process where there's a referral from a community partner or an organization, whether that be the VA or Black Family Development. And then we do an intake. We collect over 120 data points on the participants who are part of the Mobility Wallet program. We do a worksheet to determine what are the mobility needs that they have, what are the mobility providers that are available. And then we provide regular check-ins. How's it going with the technology? How is it going with your transportation options? And what's your experience with our call center? Next slide. And we also, when University of Michigan, we said, if we were to do this statewide and we were really to address this issue meaningfully, how many people would we need to serve? How many dollars would it take to support and address the transportation needs across the state of Michigan, not just in these counties? And we really came up with some concrete numbers. So for example, there are 2,600 folks who are considered asset limited, income constrained, disabled veterans without a vehicle in the household. Those 2,600 veterans, we know there probably are going to be transportation gaps, right? That's an attainable number, opposed to saying, how do we serve all 10 million people in the state of Michigan? And so we're working on not only just the data and the tech, but also what's the sustainability? If we're truly able to meet our mission and mobility solutions for the health and well-being of every person in every community, how many folks is that in Michigan? Next slide. And we also worked alongside disability advocates to make sure that the technology was accessible, making sure that not just it passed some kind of app upload super duper checkbox, but what was that real experience, and took that feedback, and we put over $40,000 of improvements in how the workflow set up, in how the alt text read. And we're very intentional at getting cross disability feedback on individuals using it with screen readers, individuals who are using it who are visually impaired and have specific things that they need to see on the screen, as well as a screen reader, individuals who have service animals, so on and so forth, and just got feedback from across the board and implemented that into the technology. Next slide. And we use the Transportation Security Index to help us understand how much do we put on these wallets. We have probably some of the highest dollars that we're putting in the wallets. They can range from anywhere from $300 to $4,500 every 90 days. And we use this Transportation Security Index score to determine kind of what level of support we're needed. And we looked beyond the mode. Just because you have a bus stop nearby doesn't mean you have the ability to walk that distance, or if you have PTSD, riding the bus isn't a trigger for you. Or just because you have access to a vehicle doesn't mean it runs, and it doesn't mean you have money for gas, and all the complexities that go into that. Next slide. So thank you so much, everybody, for your time. I appreciate the opportunity and look forward to more questions.
Thank you, Valerie. That was amazing. Now we're going to hear from Ty about the Clinton project.
Thank you, Kara. Thank you, Valerie, and the other presenters. The Michigan Mobility Wallet. You can go to the next slide. What is the Michigan Mobility Wallet? I think with the previous information, we should be pretty well caught up to speed. What it allows you to do, a digital platform integrates trip planning, the ability to plan a trip within their county or across agencies or counties through multiple modes of transportation. The booking for on-demand services and to pay for it for a fixed route service, American with Disabilities Act, ADA, paratransit, microtransit, using a unified mobile application platform. Boarding the vehicles is hands-free with your phone in the pocket, is fully ADA compliant boarding process. Next. Benefits for transit agencies. First and foremost, increase efficiencies and usability by streamlining the planning and booking processes. For us, it's enhanced rider satisfaction with the more integrated and convenient platform and booking process system. Simplifies the boarding process for the drivers, which as a transit agency, driver satisfaction is just as important as rider satisfaction. It gives the boarding process and the driver a fully autonomous experience. No touching of dollars, passes, tokens, board and go. For staff, the no counting of tokens, coins, or reconciling or punching cards is a definite plus if you are currently not utilizing a pay function on a mobile app or a mobile app period. The ACH direct deposits for transactions makes it easy for us to reconcile these fares. The ACH, the automated clearinghouse, is what I'm referring to. The API integration into your existing trip planning software. Ours currently, as Kevin alluded to, our dispatch and scheduling platform is Ecolane, along with the technology and equipment from Zed Digital, is allowing us to pilot this successfully. Like I mentioned, if you don't have an existing mobile app, this will give you the benefit of being able to book and pay for the ride in one application across multiple modes of transportation, which regional mobility is the thing of the future and where it needs to be, because you can't access everything right in your own backyard. So this will assist in that regional accessibility for your riders to connect to all those resources. Specifically for a rural transit provider is healthcare. And then I would say second would be employment. Next. Our experience with the mobility wallet thus far through the pilot, we began April, I believe, of the last year before. I'm sorry. No, this year we went live. Excuse me. We began process approximately 1 year ago, went live in April. And it's with our current mobile application, the transition of being able to pay for those rides, which was an option we did not have, gave us the ability to either transition current mobile users to a better experience, and bringing on new clients that were looking to be able to accomplish this without paying cash at the ride or balances, however you operate that. Like I said, the hands-free compliance payment process is very seamless. The ranges of the technology of the validators are phenomenal. It is the phones in the purse, in the pocket, reads it, validates it with a beep, a loud audible beep, so the passenger and the driver know that the ride has been booked, paid, and validated. The enhanced customer satisfaction, reducing barriers leading to increased ridership satisfaction. We are receiving positive feedback regarding the ease and use of the technology. A lot of people are excited about it. Operational efficiencies, the payment, once again, in the trip planning, the single system operation reduces the workload for staff in improving overall service delivery. While reducing the workload, it's really frees up more time to improve the overall service delivery. So it doesn't necessarily give people time to sit around and do nothing, but it allows you to redirect that productive time, more service delivery. Next slide. As Valerie showed you, the platforms are pretty much the same for booking process across the board with this kind of technology. You can see on the dashboard, it gives you the balance. You can have places that are saved. You can plan a trip, in My Trips, favorite trips saved, and your tickets. Participating agencies, you can see Clinton Transit there. If you were to scroll up, which you can't, on this particular slide, you scroll up, you'd have other options, like on the next slide, it shows walking, Clinton Transit, Uber, Lyft, and other participating agencies. Also, the trip purposes breakdown, this is just a snapshot of a hypothetical. It gives you the analytical data to determine purpose and further planning for demographic and age bucket use of this technology. Next slide. Also gives you the platform for the transactions. So you can monitor those real time, actually before they occur. As soon as the purchase happens, it's live. And your ticket ID will transpose into your current booking or dispatch platform. Makes the reconciliation process a little more streamlined for that. Next slide. The AI-driven payment validators, they're fully automated, ADA compliant, American with Disabilities Act compliant. Like I said already, the hands-free validation of tickets with your phone in your pocket, purse, backpack. Ticket verification integrates with the wallet, the GSM V364. The V364, I don't know what that means, but I will leave that open to your determination. The validators check for tickets while the phone is in the foreground and background mode. The validators track the boarding and alignment time of passengers. They will also do passenger counts with this particular validator, whether they are using the app or not. Origin and destination of the trips, ADA compliance, also supports your smart cards, a smart keychain validation. Overall, it transforms the experience of multimodal trip planning, real-time ride location, hands-free validation, and additional analytics. It's been very seamless for us, and a technology we're looking forward to in the future. That's all I have.
Well, that was great. And from all of our panelists, we really learned a lot about mobility wallets. And now I bet all of you want to get in on the act. So I'm going to invite all of our panelists back to the stage and open it up for our audience if you have questions. So you can ask your questions in the Q&A. If it's easier, you can ask them in the chat. You can raise your hand and I'll call on you to ask something. And or you can, if nobody's talking, you can just speak up and ask a question. See a lot of hands clapping, but we're ready for your questions now.
Kara, there's a question in the Q&A on is a product PCI compliant? And if the complexity in managing that for a transit agency. So long story short, with regard to the SCEDGO technology and product, it uses Stripe as the credit card processing, and then our call center is PCI compliant. We have all of our agents complete training and all of that, so we can take credit cards over the phone. But probably the majority of the rides are actually invoiced when we're booking rides for community partners, regardless of whether they use a bus pass or an Uber or a volunteer that's paid mileage. That community partner or that organization who's booking the rides on behalf of the third party, we just send them one invoice and they pay it at the end of the month. For individuals that private pay, it's kind of a mix of who pays over the phone and who private pays through an app. But it is PCI compliant through Stripe and then through the call center.
Great, thank you, Valerie. Did any of our other panelists want to add to that? Okay, we'll move on to the next question that came in through chat. And that is, do we know of any employers that use pre-tax deductions to fund mobility wallets? It could be in Michigan or anywhere else that any of our panelists know about. Has anybody heard of this?
I can take a stab at it. So Phoenix doesn't have any employers currently doing that. We have some who are considering it, but those pre-tax dollars require kind of a shared mobility essence to it. And the employer has to complete some additional paperwork and has to have an HR department that is up for that, as well as some educational materials provided downstream. So We do have one employer in particular. They serve 700 folks in Detroit that is looking at that, but we're just kind of at the beginning phases, but it definitely is out there. There are partners that specialize in that kind of commuter benefit side of the house. And I can brainstorm and get those links and send them to Kara to send out. But it is a complicated mechanism to deploy this in that kind of tax commuter benefit package, but it's not out of the realm of possibilities. We've learned it takes a lot more than what we thought it would to kind of take advantage of that. And I welcome Ty, Kevin, Andrew, please weigh in accordingly on any additional feedback or insight on that.
Yeah, nothing, we had no request as far as that currently. I do see that being a definite move forward as the technology progresses and it becomes more visible.
Great. Okay, we had two more questions come in through the Q&A. And the first one is about using the system to send trip requests to partners that did not have the same level of technology. From what this question says, does that use the same technology as the mobility wallet? Or was there something else that was set up to do that?
Yeah, great question. So we worked with Skedgo to build, we call it a dashboard. So that if somebody, let's say a rural hospital is requesting a trip, they can put in the trip request and it'll shoot over to the, let's say, a rural transit agency that uses paper manifest, right? They can then, the dispatcher can see the ride that's come in and then decide whether or not they can take it and then confirm or suggest an alternative time if they're like, oh, somebody's going to go get groceries and we can't make 9, but we can do 9:30, right? And so we needed a way for individuals who they weren't using a sophisticated API or they were using a technology that they'd been using for 15 years that didn't have an API, but it worked for them and they weren't changing. But we wanted them to be part of the mobility ecosystem. So they were still able to accept that ride from that rural hospital or accept that ride from that individual who requested the trip and then negotiate a little bit on the time or those kind of things on the back end. And so it enabled the transportation partner to use whatever technology or no technology they decide, but then the individuals or organizations can still interact within the mobility wallet and receive that benefit of having that one-stop shop with the service area and the times of service pre-programmed into the tech.
Okay, thank you, Valerie. This next question is directed at Phoenix, but it could be for anybody who does this. Is it correct that payers, insurers can upload funds to a specific individual's wallet with the platform? If yes, how does a payer like Medicaid, which will only pay for certain trips, participate? Does Medicaid participate?
Yeah, this is a great question. How we have that negotiated, if you will, is relative to it's a budget. So if I'm uploading funds, let's say Andrew's taking a ride or Andrew's getting a mobility wallet and Kevin is giving him $50 on his wallet, it's a budget. And so Kevin or Andrew can book up to $50 of those rides and then we will bill Kevin at the end of the month for the actuals on those. So let's say Kevin or Andrew only uses $10 worth of that $50 ride. That organization doesn't have that $40 hanging out there to be used or not used, but they know that Andrew's wallet cannot exceed $50. So that's how we manage that budget. We have had some conversations with managed care organizations in creating mobility wallets to support high need complex care. In the case of Medicaid, it does not work for the current ecosystem of the approved Medicaid rides, because if I want to go to church or if I want to go to the grocery store or I want to go see my sister using the mobility wallet, there isn't a threshold that will prevent somebody from using the wallet for those things. So it doesn't work in the traditional Medicaid sense. But nationally, we're actually working on a way to decouple that, similar to how you've seen the Fresh RX mechanism or the Fresh RX move going forward, or how EBT dollars where you could only use them for milk and eggs. Well, now you go to the EBT or the grocery store with the EBT card and you can get chicken nuggets, you can get oat milk, you can get whatever you decide that works best on your family that's eligible in that store. We see the same for changing how mobility ecosystems are set up from a policy perspective in the long run. We know that's not going to happen tomorrow, but we have a $12 million grant with the National Institute of Health to do just that. So if we give a patient with cancer $1,000 a month to get to any appointment or grocery store or place of worship or whatever they need to do, that's their decision to decide how do we see better health outcomes. And so we're actually using this technology in that mode and have some partnerships that hopefully will move that bar further faster.
Thank you. And this question is a little different. So really, any of our panelists who want to answer it, are the trips on the wallet negotiated using the 60-minute ADA window? Or is that just something specific for ADA complimentary paratransit trips?
This is Aaron with Ecolane. I was just going to chime in on that question. What I really like about our software and ultimately the application itself is that we can configure that per what we would call a funding source, or basically a program. So ADA could be a program of its own, and we can negotiate 60 minutes on either side of the request. Whereas maybe a more customized service, an on-demand or a micro-transit, maybe they only want to negotiate forward off of a request. So I work until 4 o'clock. I would never want the bus to pick me up before 4 o'clock. So actually using the Evolution Ecolane platform in conjunction with our mobility wallet product, we can customize that by program. TIE's program, for an example, they're using multiple different funded programs. They can have that set per program to be a little bit different.
Excellent. I have a question, just general. The Michigan Mobility Challenge, when is it going to be moved from a challenge to a fully completed project? What are the next steps?
That I'm not exactly sure of. I think what's taking up most of the mobility innovations staff's time is Michigan has gone through all of our mobility as a service RFP responses, and we'll be making some announcements regarding those very soon. So I'm not sure what the next step is on the mobility wallet itself, but we are moving forward on mobility as a service as a next step from here. So
yeah, I mean, I wonder if eventually it'll go beyond one state and you'll be able to have a mobility wallet for, like, you can use the bank EBT cards in other states too. Be interesting. We got another question. How do people who use the mobility wallets apply, not the people, the agencies who are involved apply to get the transportation funding? And most importantly, if any of you know this, what is the cost, or, you don't know the exact cost, but some of the slides had some costs to implement this mobility wallet in a transit system?
Those are great questions. So I can take it from how Phoenix has it laid out. So we actually use the mobility wallet technology currently in 4 states. So we are well on our way to kind of making it beyond a project, but to expand utilization nationally. And so how a community partner becomes a part of this ecosystem is they simply fill out a quick form. There's then an agreement that says, we will book rides in your app and we will pay you for the rides. And then from there, there's a monthly fee that we're right now just kind of in the point of determining what that cost is, but it's going to be anywhere from $300 to $500 a month per community organization. And that's all encompassing of the call center access, the monthly billing, the concierge, all that kind of stuff. And then to bring a transportation assistance hub to a community, it's about $350,000 a year, but that includes the tech, the call center, the staff, the navigators, all the things.
Excellent. It's good to estimate when you're doing your budgets. So thank you all, our wonderful panelists, and thank you to N-CATT, our co-host. Here are some upcoming National RTAP events. And if you remember that QR code at the beginning, you can find some upcoming N-CATT ones too. So we hope to see you again at some of these events. And here is the QR code. So we do hope that you fill out our survey. Please contact us. You'll also get the survey tomorrow. And we like to end right at 3. So we're going to do that and have a wonderful rest of your day, and hope you all implement mobility wallets, and we'll be ready to hear more. Thanks all.
Thanks, everyone.
Thanks, everyone.